Начинаем. Спасибо. Hello, everybody. Today we're supposed to discuss the second part of our prevention and dispenserization conception. Please let me know if you can hear me. Okay, so we can start. I'll try to do my lecture during 1 hour. Okay, so I don't understand. Can you hear me or no? Okay, we continue our lectures on conception of prevention. So the goal of medicine, as you know, is to promote, to preserve, to restore health when it is impaired, and to minimize suffering and distress. That is how the World Health Organization said. So these goals are embedded in the word prevention. Successful prevention depends on the knowledge of cause, dynamics of transmission, identification of risk factors and risk groups, availability of prophylactic or early detection and treatment measures to appropriate persons and groups of persons, and continuous evaluation of and development of procedures applied. The objective of preventive medicine is to intercept or force the cause and thereby the disease process. Levels of prevention. We can say about several levels of prevention: primordial, primary, secondary, and tertiary. Primary and primordial are most likely the one we can unite in one group. So primary prevention, that is the scheme for proactive health protection. Secondary prevention, early recognition, reversal to good health, and tertiary medical surgery treatment, rehabilitation, recovery. So primordial prevention. This primary prevention is per se in its sense. It implies prevention of the emergence or development of risk factors in population groups in which they have not yet appeared. The main intervention in primordial prevention is through individual and mass education, of course. Primary prevention. Primary prevention can be defined as action taken prior to onset of disease, which removes the possibility that a disease will cure. Science-based intervention in the pre-pathogenesis phase of a disease or health problem. Primary prevention may be accomplished by measures designed to promote general health, and well-being and quality of life of people or by specific protective measures. Primary prevention is far more than averting the occurrence of a disease and prolonging life. It includes the concept of positive health, a concept that encourages achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. It concerns an individual's attitude towards life and health and the initiative he takes about positive and responsible measures for himself, his family, his community. The concept of primary prevention is now applied for the prevention of chronic disease such as heart disease, hypertension, ischemic heart disease, cancer based on elimination or modification of risk factors of disease. That is the popular term, modification of risk factors. World Health Organization recommends the following approaches for the primary prevention. The first one is population strategy, and the second one high risk strategy. The population strategy is directed at the whole population irrespective of individual risk levels. For example, even a small reduction in the blood pressure or serum cholesterol of the population would produce a large reduction in the incidence of cardiovascular disease. High risk strategy. The high risk strategy aims to bring preventive care to individuals at special risk. This requires detection of individuals at high risk by the optimal use of clinical methods. Like, for example, person has risk factors of cardiovascular disease, like what? Men of like 35 years, obese with arterial hypertension, whose dad died at the age of 50 years. So we have several risk factors, yes, like gender, male, like obesity, like family history of cardiovascular disease, and clinical, even the primary prevention. We cannot modify to risk factors like family history, and male gender, but we can modify, for example, recommend to decrease weight and control. Primary prevention is a desirable goal. It is worthwhile to recall the fact that industrialized countries succeeded in eliminating communicable diseases by raising the standard of living. In summary, primary prevention is a holistic approach. It relies on measures designed to promote health or protect against specific disease agents and hazards in the environment. It utilizes the knowledge of the pre-pathogenesis phase of disease in bridging the agent, host, and the environment. The safety and low cost of primary prevention justifies its wider application. Primary prevention has become increasingly identified with health education and the concept of individual and community responsibility for health. So, of course, primary prevention, it is a much cheaper and easy and not such dangerous for people to prevent development of disease instead to manage it. Secondary prevention. Secondary prevention can be defined as action which help the progress of a disease at its incipient stage and prevents complication. The specific interventions are early diagnosis and prompt treatment. Secondary prevention attempts to arrest the disease process, restore health by seeking out an unrecognized disease and treating it before irreversible pathogenical changes have taken place and reverse communicability of infection disease. Secondary prevention is mostly the domain of clinical medicine. The health programs initiated by the government are at the level of secondary prevention. That is program on diabetes, program on asthma, on cardiovascular diseases. The drawback of secondary prevention is that the patient has already been subject to mental anguish, physical pain, and the community to loss of productivity. Secondary prevention is an imperfect tool in the control of transmission of disease. It is more often expensive and less effective than primary prevention. So basically we get patient for secondary prevention. We get patients with some disorder and we try to prevent development of complication and exacerbation if it is chronic disorder by taking medicines, and of course we still use modification of lifestyle if it is possible to avoid some risk factors. Tertiary prevention. When disease process has advanced beyond its early stages, it is still possible to accomplish prevention by what might be called tertiary prevention. It's signifies intervention in the late pathogenesis phase. Tertiary prevention can be defined as all measures available to reduce or limit impairments and disabilities, minimize suffering caused by exciting departures from good health, and promote the patient's adjustment to irremediable condition. The main interventions include disability limitation and rehabilitation. Tertiary prevention extends the concept of prevention into fields of rehabilitation. So that is the picture that shows us about the thing that we just discussed: primary prevention, public health education, boiling water, adding fluoride to water before drinking, avoiding outside food and drink, no fasting after death, monitoring of water sources and supplies channels. Secondary prevention, active and passive surveillance, early diagnosis and treatment of cases, and tertiary prevention, treatment of cases and prevention of complications. That is the idea. So we can classify preventive strategies according to level of prevention, according to target population and goals that we try to achieve. For level of prevention, we have primary, secondary, and tertiary. For target population, for primary is acceptable, secondary asymptomatic, and tertiary symptomatic situation. And the goals of primary prevention, it's to reduce disease incident, for secondary to reduce prevalence of consequences, and tertiary reduce complication or reduce disability. So the 3C of prevention are control, check, and contain. Modes of intervention. Intervention is defined as any attempt to intervene or interrupt the usual sequence in the development of disease in man. 5 modes of intervention have been described depending upon the natural history of disease. They are health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. So let's start from health promotion. Health promotion is the process of enabling people to increase control over and to improve health. It is not directed against any particular disease, but it is intended to strengthen the health through a variety of approaches, interventions. The interventions are health education, environmental modification, nutrition intervention, lifestyle and behavioral changes. Health education, one of the most cost-effective interventions. A large number of diseases could be prevented with little or no medical intervention if people were adequately informed about them and if they were encouraged to take necessary precautions in time, like we have situation with coronavirus infection. Yes, we try to educate people how to prevent infection, yes, by wearing masks, but using antiseptics and blah, blah, blah. Environmental modification. A comprehensive approach to health promotion requires environmental modifications like provisions of safe water, installation of sanitary latrines, control of insects and rodents, improvement of housing, and a lot of other things. Environmental interventions are not clinical and does not require a physician. History has shown that many developed countries have made remarkable progress in the health of people through environmental modification. Nutritional intervention. These comprise of food distribution and nutrition environmental of vulnerable groups, child feeding programs, food fortification, nutrition, education, of course, healthy food, lifestyle and behavioral changes. The conventional public health measures or interventions have not been successful in making inroads into lifestyle reforms. Health education is a basic element of all health activity in changing the views, behaviors, and habits of people. A well-conceived health promotion program identifies the target groups and direct appropriate message to them. It involves organizational, political, social, and economic interventions designed to facilitate environmental and behavioral adaptation that will improve or will protect health. Specific protection. Specific protection is some of the currently available intervention aimed at the specific protection. We have two of them: immunization and use of specific nutrients. It's also hemoprophylaxis, protection against occupational hazards, protection against accidents, protection from carcinogens. Also, we can put in specific group avoidance of allergens, control of specific hazard, control of consumer product quality and safety of food, drugs, cosmetics, water, whatever. It also protects others in the community from acquiring the infection and thus provides secondary prevention for the infected individuals and primary prevention for their potential contact. Yes, understand the point. Secondary prevention is largely the domain of clinical medicine. The health programs initiated by the governments are usually at the level of secondary prevention. Health protection is defined as the provision of conditions for normal and physical functioning of the human being individually and in the group. Health protection is considered as an integral part of the overall community development. Early diagnosis and treatment. The World Health Organization defines early detection as the detection of disturbance of homeostatic and compensatory mechanism, while biochemical, morphological, and functional changes are still reversible. Умница, я лекцию читаю тут. Перезвони, умочка, умочка. Early detection and treatment are the main interventions of disease control. Mass treatment approach. Mass treatment approach of used in the control of certain disease, like infectional diseases. And there are many variants in mass treatment, like total mass treatment, juvenile mass treatment, selective mass treatment, depending upon the nature and prevalence of disease in the community. And disability limitation. The objective of this intervention is to prevent or help at the constitution of the disease process from impairment to handicap. Just very short to remind you concept of, yes, any loss of normality or any loss or abnormality of physiological, psychological, and anatomic structural function impairment. So disease caused impairment. Impairment can cause disability. Disability can lead forward to handicap. Like, for example, loss of food, defective vision, and impairment may be visible or invisible, temporary or permanent, and may or may not lead to secondary impairment. In case of disability, because of an impairment, the affected person may be unable to carry out certain activity considered normal for his age and sex. Disability has been defined as any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being. So, handicap. Handicap as a result of disability. The person experiences certain disadvantages in life and is not able to discharge the obligation required of him and play the role expected of him in the society. So, handicap may be defined as a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of a role that is normal for that individual, for his age, sex, and blah, blah, blah. So, for example, accident, disease or disorder, loss of food that's caused by this accident, impairment, cannot work, disability, unemployment, handicap. Disability prevention. It relates to all levels of prevention, reducing occurrence of impairment. Disability limitation by appropriate treatments, secondary prevention, preventing the transition of disability into handicap, tertiary prevention. And rehabilitation. Rehabilitation has been defined as the combined and coordinated use of medical, social, educational, and vocational measures for training the individual to the highest possible level of functional ability. It includes all measures aimed at reducing the impact of disabling and handicapping conditions and at enabling the disabled and handicapped to achieve social integration. Rehabilitation has emerged in recent years as a medical specialty. The following areas of concern in rehabilitation have been identified: medical rehabilitation, restoration of function; vocational rehabilitation, restoration of the capacity to earn a livelihood; social rehabilitation, restoration of family and social relations; and psychological rehabilitation, restoring of personal dignity and confidence. So, as an end, we already discussed dispencerization last lecture, so I will not repeat it again. So just want to make conclusion. The main idea of prevention is the best idea of a health service because it is easier to prevent and cheaper to prevent disease than to manage it. There are several levels of prevention, from primary to prevent the development of disease. Secondary, prevent the development of exacerbation and complication. And tertiary, prevent to turn disability to handicap, so to let person rehabilitate, recover after complication of disease, to recover and uh, be a normal member of social society. So the idea of prevention was put in the dispenserization or prevention medical examination or medical checkup. So this led us to find out in early stages different diseases, and early diagnosis let us manage it and prevent development of complications. Thank you so much for your attention. I hope to see you on lessons. We have holidays very soon, so I try to clear all your reworks and don't have tales of it on holidays. Have a good day. Bye bye.